Hey, Dr. Jerry Williams with Urgent Care 24/7, here to talk to you today about poison ivy. But when we talk about poison ivy, it's just not poison ivy. It's actually a plant related contact dermatitis where your skin is exposed to uh, actually a couple of plants are the most common ones in the US that the oils on the exterior of the plant and interior of the plant for that matter are very, very irritating to the skin. So we're talking about poison ivy, but that also includes poison sumac. Because quite frequently, when patients present with these contact dermatitis symptoms, they'll typically have a history of having been outdoors and been working out in the yard or clearing brush, but they don't know exactly what they came into contact with. So, this is something we see very commonly at our national urgent care 24/7s, where patients will present. And of course, it can be anything from a mild rash to people just being absolutely miserable. It seems that there are people who are more susceptible to poison ivy and poison sumac than others, for sure. But I will tell you that it's a miserable condition, and I've personally had to deal with it. So, poison ivy and poison sumac are in the same family, Toxicodendron, and these plants have a phenol compound in the sap of the plant, and it's as I mentioned earlier, very irritating to the skin. And these oils, when they get on your skin, they're hard to get off. And I bring that up right now because if you think you've been exposed to poison ivy or poison sumac, I would encourage you to go to your local drugstore and get one of the over-the-counter poison ivy, poison sumac washing soaps or products, and use that immediately and as per the package instructions. We have found that these products, these over-the-counter products, can be very, very effective in limiting the spread of the contact dermatitis by removing those oils, those phenol compounds, off of your skin, and that cuts down on the spreading of the contact dermatitis. Now we see these patients, and they're usually pretty miserable. A lot of itching and pain, and a lot of blistering, and there's also a risk for secondary bacterial infections of these primary contact dermatitis areas. They can be weepy and have a lot of excess drainage, excessive drainage, I should say, and we part of what we have to do is control the symptoms, because the itching can be so difficult that the patient scratch it and that spreads the phenol compounds. If they haven't washed it yet, it spreads them even further, thus expanding the contact dermatitis. So what we'll typically do in patients where there are no contraindications, these medications, we'll give them intramuscular steroids with steroids by mouth to follow, and sometimes even a topical steroid to problem areas to help with those symptoms. We also use antihistamines, and we also use H2 blockers, which are medications that are used to block the H2 receptors, which is the histamine type 2 receptor, which is stomach acid secretion in medications such as Pepsid or famotidine. We'll also use the antihistamines such as loratadine or Benadryl, are two commonly used ones. But we use the H1 and the H2 blockers together because we now know that by blocking both of those histamine receptors, and I've talked about this in another video, but when you block the H1 and the H2 receptors at the same time, 1 plus 1 does not equal 2, 1 plus 1 equals 3. You get a potentiation of effect by blocking both those receptors at one time, it really amplifies the effectiveness of the medications. So the steroids and the antihistamines are very important. We also have medications that will help with the itching as well. The side effects of these antihistamines and anti-itching medications can be sedation, which can be a problem, and then the complications with steroids on short-term use. A lot of people will get quite revved up and have difficulty sleeping with the steroids. And some people, if they're prone to anxiety disorders or panic, they'll notice an exacerbation of those symptoms. But the steroids, antihistamines, and topicals are by far the mainstays. And the takeaway from this is, if you think you've been exposed to poison ivy or poison sumac, is to go get one of the over-the-counter poison ivy washes and follow the directions and wash very thoroughly, and because that can really put a halt to the spreading of the symptoms. And immediately treat yourself with antihistamines like Benadryl and famotidine and topical steroids. And if the symptoms are too severe, seek medical care immediately and expect intramuscular steroids and steroids to take by mouth, which can be really, really very helpful for more advanced cases. So I hope if you have poison ivy, I hope it's limited in how much you've been affected by it, and I hope that your course of contact dermatitis is shorter. And hopefully the advice I've given you today will be helpful. I'm Dr. Jerry Williams with Urgent Care 24/7. Life is 24/7, and so are we.